Hello, my friends. Anna is here in Daily Juice. I am excited to hop on and have a quick chat with you. Just want to make sure that, let me make sure, yes, this is live. Sorry, this was covering my view. How are you guys? I hope everything is awesome in your day. It is in mine, and it's about to get better because I'm chatting with you. That's, I think, the best part of my days. You know, it's actually funny how I feel sometimes that it's almost towards the end of the day, and if I haven't done a daily juice yet, I feel like I haven't completed my day. So I don't know. I hope you're learning something on these discussions we're having, but I'm certainly am enjoying doing them. So we are continuing the discussion about the open enrollment season. That's something that's taking place for most of companies, where they allow a special time of the year for their employees to change benefits, right? Make new selections and plan for next year. So that's typically October, November timeline. There's lots of different benefits that companies provide, and I wanted to go through them with you one by one, make sure that we've covered most of them, that I can provide some tips and suggestions so that you can come out looking much more prepared for next year. And for those of you who are not employed, but more like self-employed or have businesses, I'm going to try to have suggestions and tips as well. So yesterday we talked about disability insurance, right? And go back and look at that video if you haven't yet. Today I want to talk about 3 types of plans that most of us have. I know you have at least one of these because it is actually required, and if you don't, you're going to be penalized. So I'm talking about health insurance, dental, and vision. Now, if your employer provides a health insurance plan, that's awesome. Take advantage of that. But what I want you to think about is utilization, right? And a lot of times it's hard for me to, when I'm looking even at clients' plans and the benefits, it's hard for me to make a suggestion or a selection. And sometimes there are 2 or 3 options, usually 2 for sure, maybe 3 options of types of plans you can pick from. But it's hard for me to make a selection or suggestion because I have to know what are you planning to use the plan for. If you're a healthy young individual, right, then most likely you don't need or aren't going to need to have a substantial use of the plan. So perhaps maybe you can defer to using or choosing a plan that's really designed for catastrophic events, right? If something really bad happens, you need to have a surgery, or you were in a car accident and you need to go to the hospital. So you have to kind of weigh in the benefits of, and I know those things you cannot anticipate, but you can think about, and you know your health. So maybe you're not a young and healthy individual and you know the kinds of doctors you're going to. Hi, Nicholas, thanks for hopping on. You know the kinds of doctors that you're going to, you know the kinds of prescriptions you need to have. So looking at what the options are is what I'm asking you to do. Okay, so don't just safely assume that because you had this plan this year and all of a sudden your employer offers maybe a new selections, because plans change. And this whole Obamacare system, right, and you hear a lot about it on the news, is shifting and changing. So some insurance companies are actually going out of business because they cannot provide the coverage. So it's not only costing us more money, but the benefits are changing. So I don't want you to assume that you're going to have the same coverage next year. I also don't want you to assume that the plan you currently have still has the same benefits. So I'm asking you to take a look. So that's number 1 side of the health insurance plan, which is something that you can probably determine yourself. Now, number 2 is, remember, so for those of you who are self-employed, and for those of you who are like myself, who are business owners, and you have a small business that does not provide a health insurance to their employees, you have to think about coverage on your own, okay? So with the whole Obamacare Act, everybody's required, and we're getting to that point where you have to report on your tax return that you had a coverage. You're actually going to get a form in the mail. I forget what the numbers are on the form, but I've gotten one this year, gotten one last year because I have to buy my own health insurance, okay? So I have to get a form, and when I file my tax return, I have to attach that form that states that I was covered by this plan for the entire calendar year. So if you do not have that in place yet, I urge you to start looking into something like that, okay? Now, business owners, self-employed, remember that health insurance plans is something that could be used as a business deduction, okay? So maybe you can't afford to buy a plan for all of your employees, but perhaps you can buy it for yourself and offer, and this is something that I actually just did a couple days ago, hiring a new advisor, and because I don't offer a health insurance plan, I actually offered him a subsidy, right? So I will pay a certain amount per month to help him buy the coverage either on his own, or he could maybe get on his spouse's coverage. And so that will help. Hi, Tony. Thanks for hopping on. That will help him mitigate the cost. So there are different options for sure. Now, dental and vision, those types of policies are best if they're provided to you by your employers. Awesome to have, but it's not something that you can get these policies in the open market, but I've looked around and I've struggled, and I ended up not having to pay for those types of coverages, and it's just really more out-of-pocket cost that you have to mitigate, okay, and plan for. And that kind of leads me into discussing the two other types of benefits that either employer can provide. If you're not employed, you can get on your own because you have out-of-pocket costs that are associated with either with your health insurance, dental, or vision. So I am talking about here two types of accounts. One is called health savings account, and another one is called flexible savings account, HSA or FSA. Now, most employers offer either both or at least one of those. Most typical one is FSA. And so what that account allows you to do is it allows you to put pre-tax monies into it. Not a whole lot, it's only $2,500 per year, but you can use that to pay for your out-of-pocket expenses. So let's say if you had out-of-pocket cost for, let's say, dental work. I actually had quite a bit of an emergency. Hi, Andre, thanks for hopping on. So I had an emergency earlier, 2 months ago in August, where I had to pay $1,000 out of pocket. Well, guess what? Where I pulled the money from. So FSA, flexible spending account, goes hand in hand with the health plan that you have. It goes hand in hand with the vision and dental coverage. So if you anticipate, or it looks like you're going to pick a plan that has a deductible or out-of-pocket cost, then you may offset that cost with contributions that you're going to make to a flexible spending account. Now, something to remember about FSA accounts is that it's kind of like use it or lose it type of setup. So if you aren't thinking that you're going to utilize all the monies that you're saving in that account over the course of the year, all you can carry forward is $500. So I just hate you to lose the money that's not going to be spent on the medical expenses. So think about it. This is also one of those balancing acts, is that if you have a health insurance plan and it has a deductible, perhaps that's going to help you meet the deductible. But the money is going in that account is pre-tax. And so it helps you save a little bit on taxes. Okay, so that's one option. Also, something to mention is that, hi Livy, thanks for hopping on. Something to mention also, FSA account has another feature. It also allows you to save pre-tax dollars that you can use for dependent care. So for those of you who have kids and have expenses that are associated with kids, and I'm sure you do because they are expensive, that's the type of account that you can defer $5,000 a year, and then you can pull money out of that. So again, just like with the health savings account or FSA for health care, FSA for dependent care allows you to use those dollars to pay for daycare, babysitters, all sort of legitimate expenses associated with having kids. So most parents actually like that quite a bit because, again, there's lots of expenses that go with having kids. So think about, see if your company offers those, because that's quite a bit of money that you can put pre-tax, because pre-tax means you are reducing your salary or your income dollar for dollar. Okay, so that's something to think about. Now, another type of account that is often offered on employee benefit selection is health savings account. So that's the HSA account. Now, this type of account is also, just like in case of that I was using my example where I have to buy my own plan, right? I don't have an employer providing it for me. I can actually have or can set up my own health savings account. I don't have to depend on anybody. But sometimes employers offer that. So there's a bit of a different dynamic with health savings account, because the money that you save in that account does not have to be spent. So if I've saved, and there's a limit, I think it's $6,650 this year. I have to look up the actual, it's for a family contribution, and if for individual it's like $3,300. So let's say I saved $3,300 in this health savings account, but my expenses for healthcare related things, whether it's healthcare, dental, or vision, were not that much. It's neat because the money that I saved, I can keep, and it's actually can be invested. So there's lots of different options. You can invest in stocks and bonds and mutual funds. The very basic setup is it's just a savings account that earns you interest. So it's a little bit more advanced. It's not just a pass-through like it is with FSA, but it is pass-through plus features that you can actually grow the account. I actually have seen some people who have accounts that have substantial balances because over the years they've just managed not to spend it. So I want you to pay attention, because this is the time when you get to select those benefits, okay? I know it's hard with these kinds of options sometimes to envision ahead of time, but just try to think is, what are you actually using these plans for? And can you have a better setup? Maybe choosing a different plan or opting out of not having a vision. So if you're like, me, young and healthy, I don't really need glasses, right? So I don't even worry about having a vision plan, unless if I was like you working for a company, it would have been provided to me. So think about, what is it that you actually using it for, or will you be using it for? Maybe your spouse or significant other can add you to their plan and therefore consolidate and save cost. So that's another thing to think about, right? Because you're thinking about for the next 12 months. So, and for those of you who do not have these coverages, this is just a friendly reminder, because you are going to be required, particularly for health insurance plan, and you will be penalized. So if you think that you're saving money by not paying the premiums, and they're not cheap, I'm not going to lie about that, think twice, because penalties are going to be pretty serious as well. And so, and you pretty much, the way that this Obamacare system is set up, you have no way out. Okay, you're going to have to file your tax return, and if you do not have a form that states that you've paid for health insurance coverage throughout the year, that's it. That's how they get you on a penalty. So I'm sorry to be the barrier of the bad news, but that's why I'm talking to you about this. These are simple things that most of us overlook, but I don't want you to be one of those. Okay, let me know. Hi, April. Thanks for hopping on. We're about to be done here. You can watch this in replay. Thanks for hopping on. I appreciate all your comments and thoughts, and let me know, what do you think, and if you have any questions about these topics that we're discussing. I hope they're useful for you, because they are, and believe it or not, these are kinds of conversations that I'm having with clients pretty much on a daily basis. I just finished a meeting with a set of clients who were just discussing exactly the same things. So these are my tips for today. I appreciate you watching. This is Anna and Daily Juice, and I wish you guys a good evening, and stay tuned. I'll see you soon.